Good morning again. So I know you just got done talking with the doctor, but I was looking at your chart a little bit and I noticed that you are on estrogen containing birth control pills, correct? Okay. And you also potentially want to get pregnant in the future, is that correct? Okay. So with pregnancy and also these types of birth control pills, you're at an increased risk of developing a DVT or a PE. And a DVT is a deep vein thrombosis and a PE is a pulmonary embolism. And so your risk for these two conditions is elevated in pregnancy because your placenta releases more of the hormone estrogen, which increases your estrogen level in your blood. And birth control pills do the same thing. They increase your circulating level of estrogen. And what estrogen does when it's elevated is it makes the blood more likely to clot. It's a hypercoagulation. And so during pregnancy, your risk for DVT is highest, like during your pregnancy, where PEs are more likely in the postpartum portion. And since you're overweight, you're also at an increased risk for these DVTs and PEs because estrogen is actually stored in your fat cells. And so the more fat cells you have, the more estrogen you can store, which increases your circulating volume, just like these birth control pills and pregnancy does. And so I'm just going to tell you a little bit more about a deep vein thrombosis, which is a blood clot that forms in your lower extremities. And this clot can cause swelling, tenderness, redness, warmth, and pain in one leg. These occur because typically the clot partially or completely stops blood flow to everything below that point. So if your clot's like here, everything down here isn't getting blood. So that's why you see these signs. And during a physical assessment, we're looking for this unilateral calf swelling, redness, pain, and warmth. During our assessment, we're going to look at the leg, we're going to feel the leg, we'll measure your calf so we know if the swelling gets worse. We'll assess your pulses to make sure blood flow is getting past that clot. We'll elevate your legs, we'll monitor your vital signs, and your doctor will prescribe you a preventative clot medication. They're also called anticoagulants, such as heparin, warfarin. Okay. And then a pulmonary embolism is where a clot forms somewhere else in your body and it breaks off and travels to your lungs and gets caught there. And so this is a medical emergency because that clot blocking that vessel impairs your gas exchange. And so during our physical assessment, we'll be looking for difficulty breathing, chest pain. We'll monitor your vital signs, and with those, we're looking for an elevated respiratory rate or an elevated heart rate. And also, you might have a cough where blood comes up, you might have a fever, and with this, we're going to give you a medication that actually breaks up the clot, and then oxygen also. And after discharge, we'll probably take those meds like warfarin or heparin to prevent future clots. And since you said you are interested in getting pregnant in the future, I just wanted to talk to you a little bit about a risk that neonates face, like babies face. And so we have neonatal abstinence syndrome. And this is a condition that affects neonates who are going through withdrawal after birth because of maternal drug use and that drug exposure during the pregnancy. And so this baby will have tremors, seizures, twitching, tight muscle tone. They'll be fussy, they'll be excessive criers, they'll have a really high-pitched cry, they'll be poor feeders, they'll have breathing problems, fever, sweating, trouble sleeping, diarrhea, vomiting, and sneezing. And so the baby's really going through a lot, and so what we'll do is we send them to the NICU where they're put on a morphine medication to kind of ease them through these withdrawal symptoms and also to prevent them from having seizures. Okay, so do you have any questions for me? Okay, thank you.